My name's Phil Veasey. I'm the Strategic Partnerships Director at MEND. It's my honour today to be chairing this event, but I've also got 20 minutes to warm you up. And I'm delighted to be chairing today's event, as childhood health and the whole aspiration of wanting young people to be fit for the future has always been and continues to be very close to my heart. As chair, I spent a lot of time reading and digesting the conference overview, and I thought I'd give you my views on childhood health and the fit for the future debate. What would I like to see going forwards? I've always been a bit of a doer. That's why I joined MEND, and you'll hear more about MEND from Paul Sasher this afternoon. So unsurprisingly, my thoughts will be action-orientated. So what's coming up from me in the next 20 minutes? We're going to dip briefly into the London Health Strategy, the Marmot Review, and compare children's bedrooms between 1970 and 2010. We're going to travel to New York and Rio, because I've been getting slides sent to me from all over the world. And throughout the presentation, I'll give you a list of my thoughts as they gather. But before all of that, in my short time in the world of health and childhood obesity, I've found that many people in the sector really like to talk about things. They like to do a bit more research. They like to consult a bit more widely. They like to hold a conference, Jane. I would say, how much more research do we need to do before we take real and meaningful action to ensure children do become fit for the future? This slide highlights some recent research that's been published around obesity and fitness. And do you know what? It's nothing new. Lifestyle interventions such as diet and exercise should always be first-line therapy. Taking in more calories than are expended, whether by eating too much, exercising too little, or a combination of both, is responsible for 90% of cases of childhood obesity. Babies of overweight mums run the risk of obesity. And finally, one for us adults in the room today, exercise breaks could tackle obesity. We know all of this. In the case of exercise breaks could tackle obesity, how long are we going to talk about workplace wellness? Getting that life-work balance correct. I spent 6 years at Sport England. We talked about it virtually every day in team meetings, but we never got around to it. I'm not saying that research doesn't have a place, of course it does, but surely we've accumulated enough evidence to take a new stance on public health. The real focus should now be on evidence in the things that really work and sharing best practice. The Conservative Party's Health Green Paper, published way back in January this year, talked about a focus on public health and preventable disease, and it was announced yesterday, wasn't it? Anne Milton will lead on public health for the coalition government. I imagine that she knows at a time of recession and financial uncertainty, the implementation of many of those Green Paper suggestions will save millions, if not billions, of pounds. Every day in our newspapers, you can read these sorts of headlines. Obesity is the #1 health crisis. And from May 11 this year from the Times, our new leaders, whoever they are, need urgently to consider the long-term health needs of our population. And how many more TV freak shows illustrating the worst extremes of the crisis of the epidemic that is childhood obesity must we watch before we take action? And just while we're on the subject of newspapers, here's a list of the recent possible causes of cancer according to the Daily Mail. I'm not saying that our popular press doesn't publish articles about getting fitter, eating better, etc., but these stories are often buried in supplements, aren't they, deep into the heart of the newspapers. If they, the popular press, spent as much time promoting childhood health, it would be a really, really positive thing. And I'm sure I've just covered the tip of the iceberg on those causes of cancer. And how many more headlines torn from the many pages of strategy documents must we digest before we all make comparable action plans and, more importantly, find the right partnerships with the right support and right funding to implement these plans? Consider the shocking facts in the London Health Inequality Strategy, which will begin to be implemented this autumn. Average life expectancy, and this is from Boris Johnson's foreword for the report, average life expectancy reduces by a year for every tube stop passed from central London going east. So I'm a Leighton Orient fan, so that's really, I've just lost about 6 years of my life. There we go. I'll talk more about Leighton Orient at the tea break if anyone's interested. And he goes on to say, this is an illustration which will shock us all and galvanise us into action. So I would say it really is time for action. And whilst we're on the topic of health inequalities, the recently published Marmot Review, which underpins the London Strategy document, was set up to do, amongst other things, identify for the health inequalities challenge facing England the evidence most relevant to underpinning future policy and action. I saw Michael Marmot speak on the review in February this year, and in his speech he showed this chart. It illustrates very profound inequalities between social classes in terms of reading ability at 3 and school readiness at 5. So that's being prepared to get the best out of school from 5 onwards. I can hear you thinking, what's this got to do with the agenda today? The underlying premise of the Marmot Review is that there's a social gradient in health, and you could apply it to fitness, couldn't you? The lower a person's social position, the worse his or her health. So just for a moment, consider the profound inequalities between social classes in terms of reading ability at 3 and school readiness at 5. I don't have any research to back this up, but I bet if this chart was reproduced for physical literacy at 3, likelihood to join an after-school activity club at 5, and likelihood to join a community sports club at 7 or 8, they would all illustrate exactly the same inequalities. The first policy objective of the Marmot Review is give every child the best start, and this is reflected in my thoughts for the future. Health inequalities, as actually the Queen said, so I was really pleased when I was just going through my notes last night, because the Queen actually said this as well. Health inequalities are everyone's business, and in order to ensure our children and young people are fit for the future, addressing health inequalities is essential. And my second thought, and sorry about that, yesterday the Queen said that action will be taken to improve public health and reduce health inequalities. The government will create a new public health service. Let's hope it's visionary, innovative and successful, and above all else, cross-departmental. My second thought is what everybody here knows today. Every child must be guaranteed an effective and sustainable early start in physical activity in years 0 to 5. Let's now move on to the difference of fitness levels in children over the past 10 years and what Gavin is going to say this morning. Are we witnessing the first generation that will be less healthy than their parents? The first generation whose life expectancy will be lower than their parents? Arguably, the obesogenic environment highlighted in the Foresight report is at its most revealing in young people's bedrooms. Consider the following facts. For young people, TV is yesterday's news. They want to interact, and my 4-year-old godson will often go behind the TV looking for some controls to actually begin to interact with the TV. And I don't have a child-friendly home, so it's a nerve-wracking time when he pops around. And look at the fact underlined at the bottom of the slide. There's now greater parental focus on safety than the actual time young people spend online. We'll come back to this issue about this overprotected environment in the discussion this afternoon. Kids often have bedrooms that are media centres. By the age of 8, 75% of young people use the internet. 68% have their own games consoles. And by 14, 88% are online at least 5 hours per week, and social networking is becoming really, really important for them. Let's just go back to Gene Hunt and that speedy car. And you remember this when you sort of moved into your parents' home and they had that on their wall. Let's just step back for a moment to consider how things have changed over the years. From one TV and a record player in the entire house, no remote control, no fighting and haggling over that, to up to 5 devices in a 10-year-old's bedroom. Things have really changed really, really quickly, but you know all this. The scary thing is, it's only going to get worse. And I'll just skip this slide because this is what I want to read to you. Consider this. Smart paint will incorporate tiny sensor chips, monitoring sound, recognizing voice commands, communicating, processing and storing data. These chips will make young people's bedrooms into high-functionality cyber palaces with enormous electronic functionality built into the walls themselves. I bet you knew that, didn't you?